Have you ever felt like you're different, but could never quite put your finger on why? Today we're diving into something we really don't talk about enough: how autism uniquely shows up in women, and why it so often flies under the radar. Lately, my TikTok feed has been filled with women my age suddenly discovering they might have autism or ADHD. If you've been seeing this too, there's a reason. These conditions are massively underdiagnosed in women, often because the symptoms look different from the stereotypes we've been shown. Quick side note, getting an autism diagnosis isn't about putting yourself in a box, it's about finally understanding yourself. I've met countless incredible, compassionate women who spent years believing something was wrong with them, only to realize their brains were just wired differently. Stick around, because in the second half of this video, I'm breaking down 10 surprising and subtle signs of autism that often show up specifically in women. Signs you might have been overlooking or dismissing your entire life. Trust me, some of these might feel eerily familiar, and you won't want to miss it. But first, I'm going to give you 5 reasons autism shows up differently in women. Number 1 is that women are often trained to mask. Women are often socialized to blend in, be polite, and read the room. That means autistic women tend to get really good at masking. They may mimic, script conversations, rehearse facial expressions. And in my opinion, masking is one of the reasons that I think so many women are suddenly identifying with ADHD or autism content, because masking is exhausting. So when they see a list that describes feeling exhausted after social interactions or overthinking, they're like, oh shit, that's me. Often women have been taught to overthink everything to fit in. That doesn't mean you're autistic. It means you've been trained to believe your real self isn't acceptable. Moving on to number 2, special interests look more acceptable. Like special interests, or what some might call deep dives or hyperfixations, are a core feature of autism, especially in diagnostic criteria. In the diagnostic manual, the DSM-5, they are referred to as, quote, highly restricted fixated interests that are abnormal in intensity or focus. Autistic girls and women often have intense interests, but they're more likely to be socially acceptable. Things like animals, literature, or fashion. For example, someone might spend hours researching historical fashion or organizing their books by theme and color, but people just think they're passionate or creative. They may get channeled into school or work so they look productive instead of obsessive. And with women, they may be internalized so they're not even outwardly noticeable as they are in some boys. And in my opinion, no one minds our obsessions as long as they're functional, as long as they help someone else. As women, we're often socialized to think that our worth is in what we provide, so we channel our special interests into service. We become the friend who always researches the best skincare, or the coworker who organizes everything, or the girl who knows exactly what everyone's needs are emotionally because our special interest is people. And here's the thing, when people benefit from it, they don't seem to notice when it isn't good for us. But in autism in women, these obsessions may benefit those around us, may make us more successful, but that doesn't make them healthy. We might lose ourselves in it. We might stop knowing who we are without being useful. And that makes us really vulnerable to being taken advantage of. Because when your obsession is what makes you feel vulnerable, it's easy to ignore your own needs. Reason number 3, sensory issues that go undetected. Autistic women often have strong sensory sensitivities, but instead of reacting outwardly, we internalize it. When people hear sensory issues, they often picture a meltdown in a grocery store aisle because of the fluorescent lights, or someone covering their ears during fireworks. And yeah, that can be real, but sensory issues in women, especially adult women, can be way more subtle and way more polite. I once had a client who thought she was just super particular about clothes. She could not stand tags, certain seams, or anything remotely itchy. She had an entire drawer full of cozy hoodies and soft leggings, and that was like her only wardrobe. I've been thinking recently about the double bind for women with autism. So many women with autism, especially those who didn't know they were autistic, the message from the world is, Be chill, be nice. So when the lights are too bright or the tags on your shirt feel like fire ants or someone's chewing with their mouth open like a cartoon villain, we just smile. We keep quiet. We push through the discomfort and pretend like everything's fine and then go home and completely shut down because our nervous system is just fried. But here's the twist. At the same time, we're also taught that if we do speak up about these things, then we're being dramatic or picky or too much, too sensitive. So now we're stuck between silently suffering and pushing through overstimulation or risking being labeled as difficult or too much. It's like a double bind. It almost feels like we can't win. So if you say nothing, then you suffer. And if you say something, then you're extra. And honestly, it's why a lot of women, I think, don't recognize their sensory issues because we've just been conditioned to either ignore them or brush them off as preferences or quirks. But if a tag in your shirt makes you want to peel your skin off, from my perspective, that's not picky. That's something more, right? Reason number 4, emotions feel big, but they might not show it. This one is a biggie. For many women on the autism spectrum, emotions are not just felt, they're like experienced at a whole other level. Imagine like having a flood of feelings, intense, overwhelming, all-consuming feelings, and trying to keep it all together on the outside. It's like having a storm inside you while trying to pretend that the weather's perfectly sunny. It's exhausting and confusing, both for the person experiencing it and for those around them. The way women with autism process emotions often doesn't match the way others expect them to express those emotions. It's not that we're not feeling things. We're feeling them, but the way that we express those feelings might not fit with the typical, quote unquote, socially acceptable expressions that we all know. Crying when you're upset, getting visibly angry when you're angry, showing that sadness when you're in fact sad, all of that. Like, for example, imagine you're in a conversation with someone and you suddenly feel frustrated. Maybe it's because they're not listening to you, or maybe they've said something that's triggered an old wound, but instead of getting upset, you stay calm. You might even smile and nod along like nothing happened. But on the inside, you're spiraling, right? Your brain is racing with thoughts and it feels like your chest is pounding. On the outside, no tears, no raised voice, no obvious signs of distress. Now I want to throw some of my thoughts in here for a second because a lot of women can relate to feeling like they have to hide or suppress their emotions. And in the second half of this video, when I go into the signs, I'm going to explain this a little bit more. But let me clarify how this can be different for women with autism compared to what many women experience. While it's common for women to be socialized to hide or suppress emotions, women with autism often don't have the same intuitive understanding of social norms that really would help them express their feelings in a way that fits the context. So lots of women hide their emotions because they understand social norms. That's the opposite of what's happening here. Does that make sense? Those of us with autism don't understand social norms, so we don't even really know how to change that. And those of us without do know those social norms and try to suppress as a result, okay? Think about this, the next time you feel a strong rise of emotion. Are you trying to hold back those tears because of social norms that you know and understand? Or do you just not express emotions in the framework of social norms? Reason number 5, misdiagnosis is common and harmful. A lot of the symptoms of autism overlap with other conditions, particularly for women. For instance, traits like high anxiety, emotion dysregulation, and difficulty with social interactions are common both in autism and other mental health diagnoses like BPD, borderline personality disorder, or anxiety disorders. Because women with autism are often more adept at masking their behaviors, these symptoms might look like a mental health disorder rather than part of autism's broader spectrum of challenges. And that's a huge reason why women are often misdiagnosed. They're more likely to present with emotional dysregulation or social struggles that mirror conditions like BPD, ADHD, or generalized anxiety disorder. And here are my thoughts, and this might piss some of you off, but I think there's a real risk that a lot of women are going to overdiagnose themselves with ADHD and autism in the coming years, especially when masking becomes the main behavior that everybody points to and says, yes, that's autism, yes, that's ADHD. Because women especially who've been conditioned to suppress their emotions or who are exhausted from putting on social behaviors that aren't in line with their internal experience are going to hear these stories, see that one trait, it'll feel like they're just looking into a mirror. Just because you identify with masking doesn't necessarily mean you have autism or ADHD. It could mean that you spent a lifetime trying to fit into a society that doesn't value neurodivergence. And yes, that can absolutely look like ADHD or autism symptoms. So let me go through the 10 signs of autism that present more commonly in women and that are often overlooked. And as I go through these, I'll try to differentiate from those of us who are like, doesn't everyone do that? I'll do my best, okay? Let's start off with number 1, difficulty with small talk and hiding it. What this looks like in women with autism is that they will experience overwhelm with small talk, often feeling like it's shallow, unimportant, or even anxiety-inducing. They might struggle to find topics of conversation that feel genuine or meaningful, so they tend to avoid social situations or give one-word responses. However, they can hide this difficulty behind an exterior of politeness. Now, how this is different from what many women experience, most women feel socially drained at times, but for autistic women, it's a consistent struggle that feels like they're performing rather than participating in meaningful exchanges. It's not just exhaustion or awkwardness, it's a deeper sense of discomfort. Number 2, sensory sensitivities. Now, for women with autism, this can be hypersensitive to sensory inputs, things like lights, sounds, smells, or textures. These sensory sensitivities might be subtle, like feeling claustrophobic in certain fabrics or needing to avoid crowded places. Now, how this is different is women without autism, we can dislike certain textures or noises. Like, I don't really like that type of music, or that's too loud. But women with autism might react with overwhelming discomfort, sometimes even physically. This might look like refusing to wear jeans because they feel wrong, or retreating into a quiet room after an overwhelming day. The difference kind of lies in how intensely these reactions affect us and how much they disrupt our life. Number 3, a need for routine, often hidden behind flexibility. So, autistic women often feel a deep need for routine and predictability. However, we've been conditioned to push through changes and adapt, often at the expense of our own mental health. And this might manifest as trying to maintain a perfect sense of order at home or at work, but appearing flexible and easygoing to others, even though the internal stress is overwhelming. Now, how this differs from the regular woman experience is that most women might feel discomfort with change, but autistic women feel an intense internal chaos when things don't go as planned. It's like they can't move past it or shake it off, even if they outwardly try to appear that they have. Number 4, mimicking other people's behavior or personality. A common trait for women with autism is copying others' behavior, speech, or interests, often unconsciously, just as a way to blend in. This might mean mirroring how people talk or adjusting our voice or expressions to seem more approachable or natural and normal. I know that regular people can mimic others to some degree as part of what I would call like our normal social behavior, but for autistic women, mimicking is a survival mechanism. They'll mimic so much that it becomes part of their identity, almost as if they lose a sense of themselves because they were constantly performing. It's not just imitation. It's how they've learned to get through life without being like caught. Number 5, replaying social interactions over and over. For every social encounter, autistic women might replay every single detail in their heads, thinking they said the wrong thing or that they offended someone. Now, this is due to a strong fear of rejection and a deep-seated need for social approval. And I know everyone overthinks conversations sometimes, but for women with autism, this replaying it's almost obsessive. They'll obsess over the tone that they used, facial expressions, or pauses in the conversation. They're not just wondering if they made a mistake. They genuinely worry that they'll be rejected or misunderstood for something minor, even if the conversation seemed fine to everyone else. I had this patient years ago who wasn't even able to sleep at night because she'd be replaying each and every interaction she'd had that day, and some from the previous day if she didn't feel like she got enough time to kind of process them. And this was keeping her up until like 5 o'clock in the morning, just going through each and every interaction she'd had. It was exhausting to say the least. Number 6, chronic people-pleasing or fawning. Now, women with autism often struggle to say no to others, fearing that they'll be abandoned or that they won't belong if they don't just go along with what's expected. This is often learned from childhood where, we could have been conditioned to avoid conflict and perform to gain acceptance, to feel like we're part of the group, right? And people-pleasing can be a trait for many of us, myself included, but for those on the spectrum, it can be taken to an extreme. They might agree to things that they don't want to do because they fear being rejected if they don't. The key difference here is that this behavior comes from a deep-seated survival instinct, often rooted in trauma, rather than just being polite or kind. It's exhausting because it's done at the cost of our own emotional well-being, and we may not even know how to set boundaries. Number 7, emotional sensitivity that's misdiagnosed. Women with autism are often mislabeled as overly sensitive or dramatic because they experience intense emotional reactions. However, these reactions are often the result of sensory overload, emotional dysregulation, or the inability to process complex emotions in real time. And it's not just that women with autism are more emotional. They're often reacting to things that others wouldn't even notice, right? Like a tag in a shirt or a sound, an overwhelming noise, unexpected changes in plans, or feeling misunderstood. All of those things can trigger an intense emotional response. These feelings aren't about being too sensitive or dramatic. They're about being unable to filter and process external and internal stimuli the way that neurotypical people do. Number 8, social exhaustion after performing. Autistic women are often able to engage in small talk, make eye contact, and have conversations that seem perfectly fine to other people. But after these social interactions, they feel completely drained. This is due to the emotional and mental energy required to mask their true selves. And yes, everyone can feel exhausted after a big social event. But for autistic people, it's often a deep sense of fatigue that lasts longer and comes with emotional overwhelm. Like they may feel like they've just performed for hours, putting on a mask to be what others expect them to be. It's not just the social interaction that drains them, it's the constant acting that has to go into it. Number 9, trouble identifying or expressing our own needs. Women with autism are often so focused on reading others, avoiding conflict, or adhering to social expectations that they forget what they actually need or want. Autistic women take it a step further by putting others' needs before their own so frequently that they lose track of their own desires. They don't even realize when they need a break or space because they've been conditioned to always accommodate others. This isn't just about being shy or quiet. It's a survival tactic that becomes second nature. And number 10, constant internal scripts. Autistic women often rehearse what they're going to say before. They need to feel like they have everything figured out before speaking to avoid saying something that could be misinterpreted or misunderstood. And while everyone may mentally prepare for conversations, women with autism take this to a whole nother level, to an extreme. They might write out what they plan to say or overthink small interactions for hours afterward, like my patient, like not being able to sleep. It's a constant, exhausting process of managing every word and gesture because we're terrified of being misunderstood or judged. I think a lot of women are now looking at these traits and identifying with them because, frankly, I think we've all been socialized to overthink, overplease, and overadapt for so long that it's hard to tell where being a woman ends and where neurodivergence begins. So when you're feeling like you relate to all of these signs, don't forget that the society we live in, especially for women, has often conditioned us to push through discomfort, mask our real needs, and perform. And that's why so many women are identifying with these signs right now. They feel like they have to do it, that that's the only way to be accepted. But here's the kicker. While this might feel relatable to a lot of you, don't rush into self-diagnosis. You deserve to understand why these patterns exist and whether there's something deeper going on for you. So advocate for yourself, push for answers, and remember, it's not about labeling yourself, it's about understanding yourself and giving yourself the support to be who you really are.